Hi, I'm Jim Rush again, and this will be the second YouTube presentation I'm putting up. This topic will include the Healthcare Emergency Management Program components, the community and hospital hazard vulnerability analyses, and my suggestion for EM, that's Emergency Manager and Materials Management teamwork. A healthcare emergency management program consists of an internal and external hazard vulnerability analysis as the foundation, the incident command system as the structure, and the emergency operations plan, which consists of a CEO letter of commitment and a brief handbook that I'm suggesting that basically explains how your hospital responds to and recovers from disasters. Finally, the emergency operations plan is what I call the meat and potatoes. It contains a set of annexes that explain the functions that internal departments and external stakeholders perform before, during, and after a disaster. Your incident command system structure, your CEO letter, and your new employee handbook, and your emergency management plan taken together enable your healthcare organization to prepare for, respond to, the likely scenarios and your hospital's return to normal activities. Now, I remember in the old days, the emergency operations plan looked like the size of a New York City telephone directory. Very few people read it. It sat on the shelves and everybody grabbed it when the Joint Commission was scheduled to come to town. That doesn't make a lot of sense, and because if nobody reads it or people don't understand it completely, then it's not going to go well for you when the accreditation organization comes to town. And the old way also consisted of the emergency manager bearing the brunt of the program. And the Joint Commission, for years now, this is not new, but for years the Joint Commission has been testing to see the level of commitment that the Chief Executive Officer and the other C-suite members have regarding that emergency management program. So that basically, I think the new way is going to be commitment and leadership from the top. Let me just briefly explain the hazard vulnerability analyses. I look at it as twofold. The community, each jurisdiction must conduct a hazard vulnerability analyses, and that analyses basically lists the likely disasters that will befall the community. Also talks about the impact for each individual planning scenario. So the community HVA should develop 3 to 5 planning scenarios, and each of those depicting the impact it would have on the community. And the hospital needs to take that into consideration, of course, because as it impacts the community, it's going to impact the hospital. But the hospital needs to do its own independent hazard vulnerability analysis in order to list the likely scenarios internally that could happen. And remember the case where babies were taken from the nursery. We have disruptive employees. It could have the floods on the hospital. And worst case scenario would be, of course, an active shooter. But anyway, by taking those two HVAs into consideration, I think it sets you up to go ahead and develop a very comprehensive emergency operation plan. And we'll talk about that in depth in the next YouTube presentation, because that's where all the meat and potatoes are. The individuals, the annexes will be for who does what and when and where type of thing. So, and I guess as a pitch, when emergency managers are getting ready to interface with the community, I recommend a partnership with the materials management officer or the supply chain manager. And the reason for that is there's a lot of deep experience the materials managers bring with them from over the years. And so they're very comfortable with memoranda of agreements, with contracts, with all different kinds of entities. They also have a good sense for what resources the hospital has and the kinds of resources that the community is going to have to hold in reserve to back up healthcare organizations in a disaster. Now, going back to Superstorm Sandy, an image that's burned into my mind is a hospital was evacuating, and I can still see nurses walking infants down black completely blacked out, no lights, dark stairways all the way down. I think it was the 5th floor on down, and I could just imagine the parents of those children saying, you know, this is a disaster waiting to happen. Anyway, so that's the worst kind of scenario, is when your system fails and you have to evacuate. And again, the materials manager, as a partner with the emergency manager, will take you a long way to getting a good coordination with other hospitals as well as the community emergency management agency. I hope this helps, and I'll be putting up a number of other YouTube presentations on emergency management, and then later on supply chain issues, and my pitch on having a federal resource that would be able to send mobile hospitals, mobile burn centers, wound centers, public health departments, and all the supplies and equipment that would be needed to support those mobile facilities on deployment. And it's a wonderful system, and it's the one thing in my career that I just didn't get a chance to see happen. And maybe be one of you that gets a chance to champion what I'm calling the National Medical Readiness Center. And basically, in future disasters, hospitals can order whatever they need, or public health departments can order whatever they need, and in a matter of hours, the Medical Readiness Center has deployed mobile units to your jurisdiction, and it would be a wonderful program. So anyway, hope you enjoyed this, and if you did, push subscribe and you'll have access to all my YouTube videos. Thanks an awful lot, and have a great week.